Hello everyone, my name is Ali and today we're going to talk about the Perio Chart. The Perio Chart is a very useful and dynamic tool that will help dentists keep track of their periodontal examination readings. To access the Perio Chart, you simply click on the Perio Chart. I'm going to go ahead and click. On the very left hand side, you've got this box that will have the examination dates. So if you click on this, it will give you the date in which the first examination or the first periodontal examination is taking place. You can change the provider by double clicking on the date. So I'm going to go ahead and change the provider name to this doctor. Each doctor will do the reading possibly in a different day in a typical scenario. The chart is divided into 4 sections with the faces F, L, L, F, and here we've got the tooth numbering all the way from 1 to 8, 9 to 16, and then down from 70 to 24, and then 25 to 32. Okay, now we've got rows here. The white area has 6 rows, and each row will designate and relate to an examination session or an examination date. Now the date is here, and then we have other functions beneath it. The white area is used for the probing readings. So I'm going to go ahead and click on the keyboard on the readings. Okay, so this is how you add the readings, and if you want to use the keypad, you can click on the keypad just like that. But it's way easier to use the keyboard rather than using the keypad, but some people prefer the keypad. Alright, now these are the readings. If you want, you can use the triplet. The triplet will help you enter 3 numbers at a time. If the reading is the same, I don't need to enter the same reading all over again and again, so it will help me add the same reading just like that. Some people like to go the other way around. So the as I press on the keyboard the numbers, the mouse or the reading will advance to the left. I can do it the other way around by clicking on the right icon there, and there we go. It will do the update as I go there, but I prefer the left hand side direction. Okay, so what we did now is that we added all the probing numbering. We have the other functions just right beneath the probing numbering. We have the mucogingival junction, and next to it is the gingival margin, and then we have the auto calculation beneath that. The auto calculation will help dentists understand the level or the clinical attachment level, and then we have the purification, and finally we have the mobility. I'm going to go ahead and start adding the readings while keeping the same triplet number just like that. Yeah, so these are random numbers just for illustration. There we go. I'm going to go and add the gingival margin. Now here we need to pay a bit of attention. As I'm adding the gingival margin readings, I'm just gonna go ahead and finish it off. Okay, there we go. Now the auto calculation will sum up the numbering. So 4 is 2 plus 2. Here 8 is 3 plus 5. So we're summing up the gingival margin all the way with the probing, and this will give me the clinical assessment or the auto calculation. I'm gonna go and add the purification again keeping the triplet, which will help me do the readings or enter the readings in a faster manner. This is very handy and rapid. There we go. Okay, so we added all the verification. Now I will add the mobility. The system will only obviously give you the chance to only enter one number for the mobility at a time for each tooth. Okay, we're done. Now, do we need to hide any of the teeth? Maybe this was, should have been done in the very early stage, but in case you forgot, then you can say skip this teeth and skip this teeth, and if you make a mistake, you click on it again and sort of you unskip it. There are other functions in the periodontal chart, like the readings of the plaque, the calculation, the bleeding, the suppuration. So I'm going to go ahead and select teeth number 1, and I will add the plaque. Now here's an interesting trick. So if I want to add the plaque reading on the teeth, I can click on it, or I can click on P on the keyboard. So P for plaque, C for calculus. I'm going to add a lot of bleeding there. Okay, and you can add more than one notation, like on the same tooth I can go back and add a calculus and bleeding at the same time, and all will be reflected in a very interesting manner. So P, C, B, 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 C, B, and as you go along it will be updated. Okay, now let's talk about the index. If you click on the calculate index, it will go ahead and do some sort of an algorithm to give me the percentage of, for example, the bleeding. So in a typical scenario, each tooth will have 6 sides, and if we have 32 teeth, then we're talking about 192 sides, and if we have 19 or 20 of teeth having bleeding, then the percentage will be 10%. In this case, in this patient, according to this random reading, we have 62% for the bleeding. So that's the index. Next is the red F section. So what I can do here is to set the limit where I want the readings to go into the red color. So if the mobility is 1 or larger, then it will be red, just like this one, for example. But if the probing is 4 and above, then the reading will be 4, and I can simply change that into 3, and it will go ahead and update the whole dental chart. This you need to be careful about, because once you change it, it will affect all of the other periodontal examination done for other patients. So this is not per user, but rather per for the whole entire system. Okay, now last but not least, we're going to talk about the graphical representation of all the work we've done. So this will give me the graphical Perio chart, which is basically a generated graphical interface of all the work we've done for this patient, and it will have colors of all the notations of all the readings we've conducted. For instance, these filled triangles will show me the purification, while the this line, for example, will show me the gingival margin, the clinical attachment in this purple color, and all of these other functions like the bleeding, the probing, all of it can be changed. If I want to, I can change basically the colors of the graphical Perio, simple as that. And as you can see, this is a very interesting tool, not only to help you understand the clinical situation of the patient, but to also educate them. And this is the purpose of this periodontal examination. The last feature that we can talk about is saving to images. So if I go ahead and click on save to images, this will help the system save a copy of this examination into the medical section of the system, and I can also go ahead and click on print, and will print the periodontal chart. That's it for the periodontal. If you want to add another exam, you basically do the same process, but the idea is you will be able to compare the numbers and the readings, and you can go through the whole process all over again. And if I click on the first examination, it will show me the differences between the two readings. Thank you very much, and have a nice day.